Month 3 means that you are finishing that first trimester. Hopefully everything is going to look a little bit brighter as we finish up this month. Now, month 3 is months 9 through 13. If you're calculating weeks, remember in the medical field, we talk about it by weeks, not so much by months. And you'll also hear trimesters. So the first 3 months is the first trimester. All of those are important things to know. And as a reminder, I put my weeks in my planner just because I could never remember what week I was on. And when you go visit a provider, they'll say, "How many weeks are you?" And you'll just want to know. Okay. In month 3, you are hopefully going to have your first visit with your provider. Now, you might have had it in month 2, but most people seem to have it between 9 and 13 weeks of pregnancy. I wish we could get seen in week 8 of pregnancy, but I know OBGYN practices are so busy. Now, if you have not found a provider yet, I am a huge fan of certified nurse midwives. That's abbreviated CNM. Check your insurance guide to see if there's any in your area. Huge fan of them. They do show better outcomes for low risk pregnancies. Now, I gotta say that first checkup is always a little bit annoying. A lot of it is checking your insurance so that they know that they can get paid. There's going to be a lot of blood work taken, like an extreme, like you're donating blood is how I felt. There were so many tubes that they took. Now, another thing you might not be thinking about is them doing STD or STI testing. It's really important that baby grow in the most benign area as possible. So if you have an STD, including gonorrhea, syphilis, herpes, chlamydia, you want to get those tested during pregnancy. And yes, the prevalence of STDs, STIs is definitely increasing in the United States, especially syphilis, and we need to take it very seriously. So if you were to come back positive for any of those things, be sure to listen to your provider and make sure that your partner also listens to the advice of your provider as well. At that appointment, your provider should go over your risk for preeclampsia, because studies have shown that we can decrease your chances of getting preeclampsia if you take aspirin. Now, not everyone should be taking aspirin, although I know a lot of providers are edging to the point where they think everyone should be. If you have issues like a gastric ulcer or a few other things, there will be things that they say do not take aspirin during pregnancy. But there's a lot of things, including in your history and your family's history, like your mom or your sisters, that if they had preeclampsia, it's important to know. So I would recommend calling your mom and your sisters, especially if they've already had babies, before you go into that first appointment, just so you know a little bit about their history, and then you can find out if aspirin is right for you. The information on aspirin is rapidly changing. As of this filming, they are recommending a low dose aspirin, otherwise known as a baby aspirin, if you are at risk for preeclampsia. And remember, it does not eliminate your risk for preeclampsia. It decreases it, meaning you might not get it, you might not get it until later, or you might not get it as severe. Preeclampsia is one of the main reasons we end up inducing during pregnancy. So if we can delay that and you don't get it until later, that can be a really good and big thing. During this time frame, you should also be getting that first ultrasound, which is so exciting. During that ultrasound, the main thing that they are checking for is to make sure that baby has a heartbeat. It is possible to have a positive pregnancy test, but then go in and find that there isn't a heartbeat. And hopefully that isn't the case for you. I am here to say that it is normal to not feel any fetal movement. A lot of people do not have a lot of early pregnancy symptoms, so that first ultrasound can be really reassuring. At that first ultrasound, they're also going to be measuring the baby. During the first few weeks of pregnancy, all babies grow at the same rate because it is just a certain number of cells. So we can really easily predict what day you got pregnant and what day you'll have the baby with an early ultrasound. This is not so much true at the later ultrasounds that you will get throughout your pregnancy. And if you're interested in more information about ultrasounds, I did a podcast with one of my favorite stenographers. I'm going to put the link down below. Okay, so what if you go to that first checkup and you're like, nope, this is not the provider for me? First off, it's so important that you get seen, have that discussion about aspirin, have your blood work taken, and get that ultrasound. So I'm glad that you found a provider, and I am here to tell you that you do not need to stick with that provider. I am also here to tell you that if they are pressuring you to pay the full global fee that will be your part after insurance, I would not pay that early on in pregnancy. Now, if you get to 40 weeks and they're pressuring you, I probably would pay it because I don't want to have to worry about it after baby comes. But early on in pregnancy, I would maybe just be paying a simple copay. I would not be paying the full global fee because it can end up being problematic if you switch providers. And I want you to have the ability to pivot and switch providers if you find that this one is just not right for you. So many people stick with a provider that isn't right for them just because they think it's going to be difficult to change. And I'm here to tell you that it is not all that difficult to change. Your new provider can easily get your lab results and the ultrasound results, and you can be off with them and feel so much better about your prenatal care. I would recommend to switch if you find that it is just not jiving with you. I am also here to say that a lot of you have very few options during pregnancy. Maybe you're high risk. Maybe you live in a maternity care desert. And I'm sorry that we have so many places that it's difficult to get care. But if it's possible to switch, it might be worth at least looking around. Now, here's something important to remember. Your provider is going to offer you an ultrasound. Now, in the medical community, we call it an order because they are ordering the ultrasound people to do the ultrasound, but they are not ordering you to do the ultrasound. Now, I'm here to tell you that that first ultrasound is so exciting. And of course, you want to see the baby's heartbeat and all of that. But I want you to take this time to make the choice to get that ultrasound. As you start taking baby steps in making choices during your prenatal care, it is going to serve you going forward. Remember, your provider is not telling you to get an ultrasound. You are making the choice. And ultimately, the outcome looks the same. You go and get the ultrasound, but inside here, it's making a difference, and you're going to make good choices as you move closer towards your delivery. Now, month 3 can be a slog. And so I have a video on happiness habits during pregnancy. I'm going to link it up above because I think it can be really helpful about this time. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. And remember, all of these are baby steps towards birth and bringing baby home.